palsy, liver ailments, menstrual abnormalities, breast cancer, female infertility, the decline in libido, endometrial cancer, mental stress, blood circulation diseases like arteriosclerosis, cholelithiasis, etc. These are some of the diseases which might come up with obesity. This list seems endless. But before knowing how to end obesity, one must know what is obesity. Who would you consider a person to be obese? A person who has a BMI, body mass index, of over 30 is considered to be an obese individual. But how does one become obese? In theory, causes of obesity are genes, intake of fatty foods, lacking physical activity, food habits, laziness, and endocrine problems. What are the available remedies for getting out of obesity? Liposuction. It is a surgical process where the fat is removed by sucking out the fat from the body by inserting a needle. Surgery. Commonly this procedure involves surgery of stomach and intestine to lower the intake of food. Diet pills. The majority of the diet pills are for short-term use only. These diet pills are effective only if they are used in combination with exercises and a controlled diet. Fat-burning pills. These are short-term quick fat-burning pills. But the main problem with this medication is that the results are short-lived. Once the medication is stopped, the fats again show up. Exercises. It is an age-old technique of obesity reduction. It is a natural process, so side effects are not there. Controlled diet program, like exercises, this too is a natural process. Here a limited amount of food is taken which controls the formation of fat in the body. Acupressure and acupuncture, age-old technique, but nothing concrete has been proved yet. Whatever be the method of getting over obesity, there is no better method than natural methods like exercises and controlled diet programs. And if a diet pill like phentermine, Adipex, Acomplia is introduced, the effects would be visible within a short period. Apart from physical aspects, obesity may also let you feel dejected, out of the world, and may make an individual abstain from social gatherings. If you are obese, it is time to act. Whatever remedy you choose, you should always consult your doctor for his view on that remedy. Hypertension is a medical disorder in which the blood pressure is raised to high levels. It is one of the signs that an individual may have a stroke, heart attack, or heart failure. Some patients who have hypertension have been known to have aneurysms as well, and this can lead to serious kidney problems. The level of a person's blood pressure will determine the risk of developing several diseases. Because the blood pressure of a patient may vary greatly, a diagnosis for hypertension should not be made unless 2 or more readings have been taken. If a person has a blood pressure level that is at 120/80ths or 139/89ths, they are considered to be at a normal level. Prehypertension is not a condition but is a category that can help identify patients who are greatly at risk of getting hypertension. If a person is suffering from diabetes, a blood pressure level that is higher than 140/90ths will put them at risk for developing hypertension. Several factors will determine the risk of a person getting hypertension. The age is one of the primary factors. Older people have a higher likelihood of developing hypertension compared to those that are young. Individuals who consume excessive amounts of salt are greatly at risk. People who live a sedentary lifestyle and don't get sufficient amounts of exercise may also have a high risk of getting hypertension. The use of cigarettes or large amounts of alcohol will also play a role in personal risk. In addition to this, obesity, stress, and saturated fat are important factors as well. The underlying structures that are connected to these factors in hypertension are well understood by doctors and scientists. There are 3 common causes that most experts believe is connected to hypertension. The first is the failure of kidneys to get rid of excess sodium. The second is highly active renin that causes the vasoconstriction of water and sodium. The third cause is believed to be a sympathetic nervous system that is too active and causes an abnormal amount of stress. Hypertension is a condition that produces virtually no symptoms. Patients who are at an advanced stage of this disorder may have headaches and their vision may be blurred as well. Advanced levels of hypertension can also cause kidney failure, and this is one of the most serious symptoms. When a patient is suffering from renal failure, the term accelerated hypertension will often be used. While young women don't generally have high levels of blood pressure, many of them will get hypertension while they are pregnant. These women will need to be given medication, as hypertension can lead to several complications with their pregnancy. A diagnosis for hypertension will often be made based on the blood pressure levels of the patient. Multiple measurements should be taken, and they will all need to be spaced weeks apart. However, if organ damage has occurred, the diagnosis and treatment may need to be made quickly. Hair diseases and hair loss are interrelated. One cannot be thought about without the other. Common hair loss causes no single factor can be marked out as the universal cause of hair diseases. Several causes are varying from person to person. The two types of hair loss diseases. The hair loss causes can be broadly divided into the following two groups: the temporary effect and the one involving a prolonged action, usually triggered by genetics. A. The temporary effect. Usually such cases can be cured by medications and treatments. B. Prolonged hair loss diseases. Such cases may require long-term treatment. Sometimes the drug treatment might appear to be ineffective. In such circumstances, surgery like hair transplantation may be the way. The causes of temporary hair loss include the ones like childbirth, using birth control pills, etc. Another key factor can be a hormonal imbalance. It can have a severe impact by causing pattern baldness. The latter comes in the list of major hair diseases. The relation between hair diseases and hair loss. It is sometimes found that a particular hair loss cause is more commonly related to a particular hair disease. In this context, one can refer to the acquired hair shaft defects. These defects are usually triggered by the excessive use of hair treatments and styling products. Similarly, infectious diseases have their root in the unhygienic scalp. The common causes of hair loss diseases. The common causes of hair loss diseases include the following: hormonal imbalance, ailment faulty hair styling, inadequate diet. Hormonal imbalance in men. Hormonal imbalance is a major cause of hair loss diseases among men. The male hormone testosterone plays a key role in actuating hair loss. The enzyme 5-alpha reductase in the hair follicles turns testosterone into dihydrotestosterone (DHT). The latter is the most potent androgen promoting male pattern baldness, the common hair loss disease. In women, imbalance in thyroid hormone is a key cause of sudden hair loss among women. The thyroid glands being and the state of overactive and underactive might cause hair fall. Thyroid hormones largely influence the cellular metabolism of scalp proteins, carbohydrates, lipids, and minerals. And the hair matrix cells are highly affected by the thyroid hormone's excess or deficiency. Hormonal imbalance also causes hair loss during pregnancy. Pregnancy witnesses a high level of estrogen hormones. This causes hair follicles percentage in the anagen growth phase. But post-childbirth there is a rapid fall in the estrogen level. Consequently, a large number of hair follicles shift to a catagen phase. And gradually hair falls. Women may also experience hair loss during the post-pregnancy period. It is generally temporary. But if it continues for months, then it may indicate a hormonal imbalance in the body. And hormonal imbalance for an extended period requires proper treatment. Ailments. Some of the serious ailments like high fever, severe infection, or flu may lead to hair follicles to a resting phase. This condition, called telogen effluvium, results in increased hair fall. But it is a temporary condition soon to be followed by normalcy. Some cancer treatments also prevent hair fiber growth. The hair becomes thin and breaks off. And gradually hair loss occurs. The condition starts within 1 to 3 weeks after the beginning of the chemotherapy treatment. The treatment may witness the patients losing up to 90% of their scalp hair. Faulty hair styling. It means using certain hairstyling techniques resulting in hair loss diseases like traction alopecia. In this condition, the hair fibers are pulled out from the hair follicle by a hairstyle that pulls on the roots of the hair fibers. One example of such faulty hair styling is braiding cornrowing. Cosmetic treatments like bleaching, coloring, or hair straightening like chemical relaxing can also create problems if proper procedure is not followed. Inadequate diet. Taking up crash diets for rapid weight loss may lead to hair loss. Such diets are low in protein, vitamins, and minerals, thus causing malnutrition. Abnormal eating habits lacking important nutrients can also result in hair loss.